Hello, good afternoon. My name is Dr. Chudi Ufondu, and today is another opportunity to understand the basics for fertility in 2023. So, today we're going to talk about the ultimate fertility diet in 2023. What are those food items that when you consume them, you will maximize your opportunity of becoming pregnant? And not just becoming pregnant, actually succeeding in becoming a mother and also a father. So I'm going to make it very straightforward. I'm going to give you the tips, what you need, and I will encourage you to go home and make sure you incorporate these food items into your routine, and you're going to come back with your testimony. Now, if today is the first day attending my clinic, thank you. I appreciate you. My clinic is every Tuesdays and every Saturdays. Saturdays, 6 p.m. Nigerian time, 12 p.m. Eastern time. So please, before you leave today, make sure you subscribe. Make sure you set your notifications so that anytime I come live, you will have opportunity to participate in real time. Immediately after this clinic, I'm going to run another clinic in Facebook, and I want to invite you to join us in our Facebook group and our Facebook group. You're going to learn a lot of things. You're going to get a lot of tips that will help you to accomplish your goals. So many families want to start their family in 2023. So many families want to have their boys, their girls, their twins, their triplets, their quadruplets. It's possible to start your family. It's actually possible to complete your family in 2023. So, everything you need that will help you to actualize this dream, I will encourage you to gather them. And top on the list is your knowledge. So, I'm going to start without wasting time. Once you come in, you just join us. And admin is also going to hang around. So, remember, we have a big event on the 29th, which is next Sunday, the Fertility Summit, SGHS Fertility Summit. So I'm going to give you specific food items that will ultimately improve your fertility. Number one, quick tip: when you have a chance to eat in 2023, consider eating more plant based foods. Plant based foods in lieu of animal based foods. If you want to start your family, you are going to get a lot of help fertility wise when you consume more plants than animal. So when you want to get your protein, you are better served consuming your plant based protein in lieu of animal protein. And I'm going to give you a couple of tips, couple of specific food items. Consider your whole fruits. You can eat your fruits unpeeled. You can peel them like your apple. You can peel your apple. You can peel your guava. Consider your bananas. Huge. You can't go wrong with your bananas, your oranges, your strawberries, your raspberries, your mangoes, and your pineapple. Guess what? They are very good. The reason why you need to consume all these plant-based fruits, they are high in antioxidants. You see, some reasons why so many of our members are not having their babies is because they have a lot of oxidants. They have a lot of what we call free radicals. Free radicals love the sperm cells and the egg cells. So when you have a lot of free radicals in your body, they will go and damage those egg and sperm cells, leading to inflammation, leading to infection, and ultimately affecting your ability to become pregnant. But when you consume a lot of antioxidants, food items that will increase the antioxidative stress, that means it will go and stop those disease and inflammation causing condition. So consider your whole fruits, your apples, your bananas, your oranges, your strawberries, your raspberries, your mangoes, your guava, and ultimately your pineapple. Remember, even when you succeed in becoming pregnant, you can eat all these food items. They are very, very good. Number two, you should know this by now: your vegetables. You can't go wrong with your vegetables. Your vegetables are amazing source of also antioxidants, all the nutrients you need, your folic acid, which will help in proper development of your baby, your iron, your calcium. There are so many good stuff that come from your vegetables. And remember, when you combine your natural plant-based fruits with vegetables, you are also ensuring that your body weight is within the normal range. One of the reasons why so many people might have problems conceiving it, because their body weight is not good, because their BMI is high or their BMI is low. So consider your tomatoes, consider your potatoes, consider your onions, your radish, your corn, your carrots, your cucumber, your broccoli, your spinach, your cauliflower, lettuce, beans, eggplant, asparagus. Now, it might sound so simple, but trust me, when you eat your food as your medicine, you will never consider any medicine as your food. Admin, capture that for me. When you eat your food as your medicine, you will never take your medicine as your food. And the same thing is also applicable towards starting your family. It's possible you've been consuming a lot of fertility drugs, herbal drugs, concussion. You've gone up and down, but the problem you might be having is what you eat. So please, starting from today, consider these superfood ultimate fertility diet. It works. Number 3, seafood. Remember previously I told you about plant-based food, right? Now, when you consider the type of food you want to eat, when you transition to eating animals, seafood, amazing. They are very good source of the vitamins, the oil, the fatty acids that will help to make sure you eventually succeed in becoming pregnant. So your seafood is very important, especially in omega-3 fatty acids. Omega-3 fatty acids, it's very important in producing all the reproductive hormones. It's very important in the ovulatory cycle. It's very important in the process of producing sperm, which is spermatogenesis. So when you think about your seafood, think about those fishes, but be careful. There are some seafoods that might contain high level of mercury, which can actually be anti-fertility. So when you think about your oysters, your clam, your some fishes, and what have you out there, please consume them. But be mindful the mercury content. It's important to check the mercury content. Form the habit of reading the food label. When you go out there to buy anything, be careful. There are so many artificially synthesized food, they use antibiotics and a couple of other things. Be careful. You are better off consuming organic food. If you can, grow your vegetables, grow your fruits. If you are nearer to the villages, the fruits and vegetables you consume raw from your farm is safer than whatever you can buy in the supermarket out there. So be careful. But whatever I'm telling you today, it works. So think about all those local treasures of seafood. They are very good. Now, number 4, your whole grains. So whole grains are in the category of your cereal, your golden mom, your cornflakes, and all that. They are good, but be careful. So many of them are calorie dense. So many of them can actually do worse things. So be careful when you're consuming them. Look at the calorie content. Look at the calcium content. Look at the fortification content, vitamin D, all those important vitamins that will help you to actualize your opportunity of becoming a mother. Please consider them. Now, your whole grains will also incorporate your oatmeal, your brown rice, your whole wheat, your bread. They are all good, but please be conscious of the calories. The problem is the calories and the frequency. You see, there is no food item you should avoid, but the problem is the quantity you consume from them. If you consume a lot of carbohydrates frequently, regularly, without incorporating other food items, you're not doing yourself justice. You're practically, standing in your own way of becoming a parent. So your whole grains, your oatmeal, your brown rice. So when you have an opportunity between white rice and brown rice is always very good to people that are looking for babies. Now, raw nuts. Now, you cannot tell me you don't have access to nuts. I love nuts. I love groundnuts. I love cashew nuts. I love almond nuts. So whichever one you have at your disposal, make it your snacking alternatives. So when you're hungry in between meals, you can snack on your almonds. You can snack on your cashew. You can snack on your peanuts. You can snack on your walnut. Anyone are available. Please snack on them, but be careful. The problem here is also the habits, the frequency, the quantity. So eat like an adult. Eat like someone that wants to live tomorrow. Don't live to eat. Eat to live. Very important. Use your food as your medicine so that you will not take your medicine as your food later in life. Very important. Your nuts are very good source of antioxidants and monounsaturated fats. So the type of fats we encourage people to consume are the what? Monounsaturated fats. Unfortunately, the type of fats you get exposed to when we go out there to eat are all those Fridays, Kentucky Fried Days, McDonald's days, Mr. Big's days. They contain saturated fats, which your body doesn't need. There are some good fats you need. So consider your nuts. There are so many ways you can use your nuts. You can eat them raw, you can incorporate it to your salad, or you can use it to do whatever you want to do. But please, by any means possible, take your nuts, raw nuts. If you can grow them yourself, you're good to go. Now, number 6, your legumes. So when we talk about your legumes, you have the classes of beans, which is plant-based. You have the lentils, you have the chickpeas, you have the classical red bean, any which bean you have out there, any legume you have at your disposal, please consume that. So have you noticed a trend? Virtually everything I told you, apart from the seafood, they are all plant-based protein. So the secret to achieving pregnancy and having a good outcome in 2023 is what? Plant-based food. Anywhere you see green, embrace it. Green represents life. Green will improve your fertility. Avoid animal-based food as much as possible. I know we love our meat. I know we love different garnishes of meat. I know that. But my people, were talking about starting a family. Now, finally, olive oil. It's amazing. I'm sure you guys use it for so many things. You use it for prayers and all that. But extra virgin olive oil is also a good source of monounsaturated fats. It's highly packed with omega-3 and it will help you a lot. You can also consider your coconut oil, your olive oil. So the olive oil you normally use in praying and doing all those stuff, they are also very good in your fertility. We have noticed that olive oil and all the food items I mentioned are part of what we call Mediterranean diet. Mediterranean diet is going to help you to kickstart your fertility exactly how God wants it to be. Now, together with everything I've mentioned, remember, becoming pregnant is a complex process. So when you're consuming all these food items, make sure you stay active. The more active you are, the more you're placing yourself in an advantageous position that will eventually help you to become pregnant. This is my presentation, and I'm going to open the clinic now so you will have opportunity to ask your questions. So in the next 16 minutes, we'll have opportunity to ask questions. So the clinic is open now. Nkiruka Clementina, thank you, welcome. I can see Onyinye, I can see Chinyere, then I can see my amazing COO, Kenneth. Thank you, guys. The clinic is open. So if we don't have any other person attending, admin, I just want us to have an interactive section before we go to Facebook. So please ask me any question regarding this particular topic. Remember to register for the Fertility Summit. This is a one-in-time opportunity to get the tools you need to start your family the right way. Remember the 4 batches of babies we have: September, October, November, December. Your infertility ends in 2023. You can no longer carry your infertility over to 2024. This is the moment you've been waiting for, and your journey begins in January. The journey to starting your family in 2023 begins in January. Thankfully, we have 12 months, but all you need to become a mother or a father is 9 months. Please start asking your question. How long does it take for fertility diet to work? It's just part of what you eat every day. There is no time frame. So it's not mathematics. Once you put it as part of what you do regularly in your home, it's going to work. It will flip immediately. You can see the impact. Within a matter of 1 month, you will see the impact. The moment you start eating properly, the moment you flip your diet, the moment you start eating the fertility friendly diet, your body will even start seeing the changes. Your body weight will normalize. You will sleep better. Your stress level is reduced. And you will have an opportunity for your hormones to work. So as soon as 1 month, you will start seeing the impact of the fertility diet. It works. Trust me, it works. It will not work overnight, but over time, as you begin to incorporate this as your habit, it will work. Okay? All right. What food should I avoid for fertility? Now, exactly the opposite of what I've been mentioning. So you see all those fast foods, you see all those quick, burger, ice cream, stuff that you don't know how they prepared it, avoid them. Now, when I tell you avoid them, it doesn't mean you will 100% not eat the stuff you like eating, but there are different ways you can incorporate them. You can balance them out. So, ordinarily, anything that is edible in life and is part of the 5 classes of food, you're not supposed to avoid them. But you balance it. That's why it's called balanced diet. So I'm not a proponent of, oh, don't eat carbohydrate, or oh, don't eat this, don't eat that. I'm much more interested in the quantity you're eating and the frequency and the quality. So if you can prepare your own meals, you're actually in a safe place. But if you form the habit of eating out or eating all those highly calorific food, or you follow your taste buds, there are some people that eat because they just want to eat. You don't eat like that. You don't be a slave to your taste buds. You control what you eat so that you can eat right. You can train your higher centers. You see, when people talk about fasting as part of lifestyle, it's a choice. You can choose not to eat. You can choose to eat only twice. You can choose to abstain from things you know you don't need. And the problem is, if you allow yourself to use food as a comfort, you're constantly going to be in trouble, because every single day you wake up, you have stressors around you. So some people take to food as comfort zone. They eat to feel good. They stay up. They are not happy. They are not sleeping. They are sad. They are depressed, and they resort to eating food. And some people eat themselves to stupor. You're not sleeping, you're eating. When you're not sleeping and you're not eating, your hormones are not going to work. When your hormones are not going to work, your reproductive system is not going to work. When your reproductive system is not going to work, you're not going to ovulate. When you can't ovulate, you can't release the egg. When you can't release the egg, infertility will set in. So it's a chain reaction. Okay? Doc, any tips on how to stick to a healthy diet? Trust me, everything I've shared with you now, it's a journey. It's not a dash. When you have the consciousness that enough is enough, when you understand where you're headed to, when you understand that what you put in your body can actually kill you and limit your potentials, you see, God has given women their babies all in your ovaries. So when you consider the food you're eating, and when you understand that the food you're eating can stop you from having your family, then you change your knowledge base. So number one thing you need is your mindset, your relationship with food, understanding that you're not here to live to eat, you're eating to live. So you have to have a timetable. Then you have to go to your food pantry and clear out all those items that are not helping you and stock the right things. So the key word is stocking your fruits, stocking your vegetables, stocking your legumes, stocking your nuts. So whatever you have at home is what you're going to eat. Then you draw your food timetable, and you don't eat because you want to eat. You only eat when you're hungry, and you tame your hunger centers. And let me give you a secret. You see, the hunger centers and the higher centers in the brain, they adjust to anything you put there. When they are empty, they want something to go in there. You can use water to confuse the hunger centers. You can actually go for intermittent fasting. So the period you're not eating, you're drinking a lot of fluids, so that the hunger center, when you put water in the hunger centers, it will confuse the water as food. And you will feel full. Not eating food is not going to kill you. Not drink. The only thing that will kill you is when you're not drinking water. You can actually abstain from food and you will still be fine. So we are not in this planet to just be eating anyhow. Okay? So that's my advice. Work on your knowledge, work on your relationship with food, draft a food item, stock the right things at home because those are the things you have to eat. I know some days you will stay up late night, we do one or few things, and you're hungry. If you open your fridge and you see the right thing, that's what you're gonna snack on. But if you open your food and you see cake or ice cream, you're gonna eat that. And the problem with eating it and ice cream is because they are very sweet. So once you eat one, you want to keep eating until you eat yourself to stupor. That's a problem. Food is good, but food is here to guide us to be healthy. This is why when you think back, your grandparents, how many grandparents have obesity? How many grandparents did you see that were overweight? I didn't see one. Name one. Why? Because they are constantly eating what they are producing and they are constantly in motion and they are very disciplined. So, discipline is also important. Is pineapple good for when you're conceiving? Of course. There is absolutely no problem with your pineapple. I know there are so many theories. Oh, pineapple, this eat your pineapple, JJ. Eat your pineapple before conceiving. When you're pregnant, you eat your pineapple. When you have your baby, you eat your pineapple. Pineapple is 100% okay to eat. The same thing with pawpaw. Okay? Can fertility diet really help you conceive? Of course. Why will I choose this topic if it's not something helpful? Of course. It will work at the grassroots. You see, some of us want finished product. We want a quick fix. Oh, they'll give me fertility drug that will do magic. No. Every single food items I've mentioned will help you to start from bottom up. So it's a grassroots help. When you consume your fruits, your vegetables, your nuts, your omega-3 fatty acids, your olive oil and all that, they will help to make sure that your hormones are properly fixed. These are the things that will work at the baseline. Everything about life is grassroots. Once the grassroots is solid, the whole structures up will be fine. So it works. This is no joke. I can't spend my 30 minutes talking about things that wouldn't work. It works. Okay? All right. And we actually have a PDF for these purposes. We have a PDF of fertility food. So when you join us in our Facebook, admin can share the PDF and you can get a copy. So you can see what you need to eat. Of course, sugar, we all need sugar. So when we talk about, oh, sugar, this, avoid sugar, that's not true. Everything you eat in life will eventually form sugar. The question is, what quantity do you have in your body? Is your body able to handle the sugar appropriately? Is your pancreas, your insulin, those are the instruments that handle the sugar in the body, are they properly taking care of the sugar so that you don't have overwhelming situation of sugar in your body? So you still need your sugar. There's the quantity and the regularity. And yes, if you have excessive sugar dumped in your bloodstream, definitely you're going to be predisposed to having diabetes. Definitely you're going to be predisposed to having other things that can affect your fertility. So they might not affect your fertility directly, but they can affect your fertility indirectly because when you have issues like diabetes and all that, they can flip your hormones. And once your hormones are flipped, you're going to have infertility problems. Okay? Are there foods that can cause a woman to have fertility issues? Of course. Like I told you guys, the opposite of what I've encouraged you to eat will put you in trouble. So when you consume highly calorific food, when you consume your carbohydrates, especially the highly processed, hydra headed, saturated. So the key word is saturated. Anytime you're consuming saturated fatty acids, you're in trouble. So the opposite of what I'm telling you is what will stop you from becoming pregnant. Of course, you can't swallow in the morning, swallow in the afternoon, swallow in the night, and you expect yourself to have optimal fertility. No, you're shortchanging yourself. You have to be meticulous. You have to be well organized. You have to be disciplined when it comes to eating. Like I'm using myself as an example. I know my family lineage. I know my trends. I know a couple of things going on in my family. So I'm consciously, my relationship with food has changed. I don't just go about eating stuff because I know that I have to put in an effort. So I'm constantly on the move, looking for things I have to do. Like if you guys notice, when I'm teaching you guys, I'm on the move. I'm always on the move. And I'm careful. I'm currently doing intermittent fasting so that I can teach myself to be in charge. The problem is when we let go and when we allow food to control us, we start having problems. There are some people that are not able to become pregnant and start their family simply because of what they are eating. If they can move away from that environment, the friendship, the neighborhood where they are consuming all the type of foods they are consuming, if they can switch completely from plant-based, from animal-based to more plant-based food, they will become pregnant naturally without taking any drug. Okay? All right. The foods I mentioned are also gonna improve the sperm and egg quality. Your carbohydrate, your vegetables, your fruits, your nuts, your olive oil, and all that, they will improve the sperm and egg quality. Because remember, the free radicals damage the egg and the sperm cells. So when we have a lot of antioxidants, which will go and stop those free radicals from damaging our body, of course, ultimately, it's going to improve the function of the eggs, it's going to improve the function of the sperm. And ultimately, when the function of the eggs and the sperm are improved, then you will become pregnant naturally. Okay? All right. Good evening. Please, aside from prolactin, what causes nipple discharge? Couple of things. Trauma. Sometimes we have what we call idiopathic hyperprolactinemia or hypergalacturia. Galacturia is the expression of the breast milk. So anything that also leads to friction. So some women have tight fitting bra. So anytime you wear that tight fitting bra and there is friction between your nipple and the bra, you can actually sensitize the milk lead and reflex. So what leads to breast discharge, apart from the prolactin aspect? Whenever you stimulate the breast of a woman, regardless of the age, and sometimes we give some drugs, that woman can start producing milk. So friction around the nipple area, discomfort, and sometimes some hormonal issues besides the prolactin, like your thyroid hormones. Sometimes they can go and disrupt certain things in your body, and you will start having this problem without it being basically from prolactin. Now, some people can also have what we call autoimmune disease. So in autoimmune disease, your body is fighting your body. So your body is producing stuff that attack your body. And when that happens, it can damage that hormonal pathway. And once the hormonal pathway is damaged, you begin to develop all these problems. Can a diabetic woman conceive and deliver safely? Why not? What you need to do, if you are already diabetic, then we need to control your blood sugar. When we control your blood sugar, there's a particular test that will tell us if you are doing good or not. It's called A1C. A1C will give us a guide of your sugar level so that we can monitor you. So there are two criteria. If you were already diabetic and you're currently having infertility problem, yes, you can control your blood sugar and you can become pregnant and you can have your baby. If you develop gestational diabetes, that's the type of diabetes you can develop when you become pregnant, then we're also going to monitor you and make sure you're in a good place. Some women might require insulin. So insulin is the ultimate treatment modality for people that have diabetes. Some people will just give them oral hypoglycemics. Oral hypoglycemics are the drugs you give you for your diabetes. Diabetes has two types, insulin dependent and insulin non-dependent, type 1 and type 2. So depending on the type you have, we can manage you appropriately. The key word is knowing what you have so we can use what you have to treat you individually. So if you are currently diabetic, or if your mom is diabetic, your dad is diabetic, your sibling is diabetic, and you are planning to start your family, it's important we rule out that you don't have diabetes, because you having diabetes will place that pregnancy at high risk. Now, every pregnant woman will be subjected to ruling out gestational diabetes. There's a specific test you have to do called oral glucose tolerance test. Very important. I'm sure if you're pregnant, you would have gone for this test. When we do that test, it's going to tell us if you develop gestational diabetes so we can manage you differently. Very important. So the fact you're diabetic, the fact you're hypertensive still doesn't stop you from starting your family. But we preach on prevention. So we want to prevent you from developing diabetes in the first place. So your parents can actually give you diabetic genes, hypertensive genes, but you can modify your lifestyle and you can prevent yourself from developing it. Or when you develop it, you can develop the milder form of that particular medical condition. Can a woman trying to conceive use apple cider vinegar? Don't use any of those stuff. Any of those diets, fat stuff, especially anything that your doctor didn't recommend, do not use them. I'm not a proponent of popping things because everybody is popping it. You can do your lemon water, you can do your honey, you can do your fruit infused water. That's okay because they are all edible food items. But you see this apple cider, this and all that. Don't do that. If you're diabetic and you have polycystic ovarian syndrome, it's actually double impact. Polycystic ovarian syndrome by its merit can stop you from becoming pregnant. Then if you have polycystic ovarian syndrome, then you have diabetes on top, that's double wahala for you. So you need to go and see a fertility specialist and an endocrinologist. Very important. Stop consuming anything that doctor did not recommend for you. And not just any doctor, a fertility doctor. Very, very important. Okay, so don't consume them. All right, so I believe I've come to the end of my clinic. It's 30 minutes, and I want to thank you for coming. If your questions are not answered, you can join us in our Facebook. I'm going to go to Facebook almost immediately. So join our page, join our group. If you're in my timeline, hop in. Let's see what we can achieve. Remember, we just have about 7 days to the upcoming Fertility Summit. We have opening for only 100 people. And the last time I checked with admin is giving me a hint that the slots are gradually being filled. So you better join among the women and men that will eventually become parents in 2023. This will happen in this group. So thank you guys so much, and I'll see you in Facebook. Until I see you, God bless you and bye-bye.